What's up, guys? Welcome back to the nursing channel. So today I will be showing you guys how to interview for a nursing case manager position without having any case management experience. Okay, so I actually have with me a list of questions that they will most likely ask you in an interview for a case manager position. Okay, now I don't have a panel with me that's going to be asking me questions, but I'm just going to role play and pretend like I'm in an actual interview. And I'm also going to interrupt myself just to explain to you guys why I'm giving that specific answer, okay? Or how to conduct yourself in an interview, okay? So obviously in an interview, it's very important to show up presentable, show up in a nice attire. For us guys, wear a suit, a button-up shirt. For you women, dress nice, decent, respectful, and don't forget, because first impression is everything. Make sure you take a shower the morning of the interview, okay? So you smell good, and make sure you comb your hair. You smile, okay? If you have a nice smile, if you don't have a nice smile, it's okay. You don't have to show your teeth, but just should be polite and be a friendly individual when you greet the interview panel, okay? First impression is very important, even if people tell you it's not. It's super important because we as human beings judge each other based on the first few seconds of our interaction. Okay, so now I'm just gonna role play and act like I'm coming into the interview. Hi, my name is Sam. Nice to meet you. Sam, nice to meet you. Okay, the first question is, why did you pursue this career? So I pursued, so I'm pursuing this case manager position just because I want to stray away from doing direct patient care. I feel like the case manager position will allow me to still be able to interact with patients, still get to know them, and I can still, provide care to them in a different way. I may not be giving them medication, I may not be doing wound care or taking vital signs, but I at least can help patients by giving them the resources that they need and making sure that they have a safe discharge disposition to go to, which is very important. So that's one of the reasons why I got interested in doing case management. Also, I feel like case management is a career where I can dedicate myself to long term. As a bedside nurse, it's really hard to commit to it long term because the human body starts as years go by. You start to get older and you don't have the same strength as you did when you were younger, and so I don't think that doing direct patient care is a career long term. So that's why I chose case management, because I think I can still contribute in the care of patients, and I plan on doing it long term. So Sam, what attracts you to this role? So what attracted me to this role is that I can still contribute to patient care by, like I said, giving the patient resources and the adequate support that they need. For example, if a patient does not have a safe place to go to, or if a elderly patient is being abused at home, we can make sure that that elderly patient has a safe place to go to once he gets discharged from the hospital. We can always contact CPS and make sure that we work on giving him a safe discharge plan, even if that's getting the patient to a skilled nursing facility. Why did you leave your last job? So I left my last job primarily because I wanted a different change in scenery. I wanted to move out of the city. The city is very busy. There's a lot of traffic and all the pollution that you have to deal with, and it's just, I feel like it's really crowded, the city. And so I decided to leave my job and move to the country, and that's why I decided to apply to this hospital and specifically to this position, because this hospital is obviously in a rural area, and yeah, that's primarily the reason why. What did you like about our company from what you've learned so far during the hiring process? So far, what I like about this company is that you guys are really big on customer satisfaction and or patient satisfaction. You guys make sure that patient needs are being fulfilled and patients are being taken care of, and they're satisfied with the care that they're receiving here. Um, and this company, which is Kaiser, I actually grew up. I was raised in the Kaiser system. My mom had health insurance for all of us with Kaiser, and I always liked, coming to the hospital because the Kaiser nurses were always friendly and always greeted you with a smile. And every time I got my lab draws or my blood draws, they would always give me a lollipop at the end. So I always really liked coming to the hospital, specifically the Kaiser hospital. Should you get hired, what do you think would be most challenging in this role? For me, I think the most challenging thing would be just to know where all the resources. For me, the most challenging thing was just to become familiar with where things are at, like where are all the forms located, all the phone numbers that I need to remember, like the phone numbers for the doctors and the different floors in the hospital. Just familiarizing myself with my new work setting. And yeah, I think I just knowing where things are located, which resources, what resources I have access to here in the hospital. What skills or qualities do you possess that will support or contribute to this company's mission? So I think I can contribute to this company's mission just by being my friendly self and just being compassionate with patients as I interact with them, and just trying to be a resource to my staff and be able to my fellow staff members. Just being resourceful to my fellow staff members and helping them in whatever way I can. And I hope that, they can help me out in return as well. And just being friendly with my coworkers and supporting them if they need my help, and just being available. What experience do you have that will make you a great fit for this position or role? So I think that the nursing experience that I bring, that I have from working on the floor on med surg and telemetry, I think I can bring that experience with me over to the case management role, because I can, as a nurse, I can anticipate what patient needs are, because I've worked with patients directly, so I can kind of figure out what they would need discharging from the hospital. For example, if a patient is newly diagnosed with COPD, I can anticipate that they're most likely going to need oxygen. Or if a patient just came off of knee surgery or hip surgery and they don't have they don't have enough support at home, I can anticipate that they're going to need home health services. So yeah, I feel that's the type of experience that I bring to this role. What would you say are your weaknesses as an employee? I think my weaknesses as an employee are I like to ask a lot of questions, and so I guess sometimes that can be overwhelming. But it's just initially when I first start a new role, I like to ask a lot of questions because I want to gain as much knowledge as I can so I can be skillful in my position. What would you say are some of your strengths as an employee? I think some of my strengths are my organization And another strength would be just my ability to prioritize patients and just being able to figure out which patient I should tend to first, and then which one comes second and which one comes third. What have you done in the past in order to calm an upset patient and their family? So in the past, to calm down an upset patient or a family member, I will first listen to them and be empathetic and just let them know, hey, I'm here for you. I'm sorry that things aren't going your way, but I'm I am available to you and I'm willing to work with you as much as I can, as long as, it is appropriate. And usually when I say that to a patient, patients kind of calm down and they de-escalate, and they're more approachable. Describe an emergency situation in which you had to act quickly. Would you do anything differently if you had to do it again? So I remember working on the floor. I had a patient that coded on the bed, so I had to react quick. I activated the code blue button, and then I just went in straight into checking if the patient had a pulse, and then I started doing compressions, and I called for help, obviously. So that was one moment I can remember when I had to act quickly and on my feet. What is the greatest challenge that you faced on the job? I think the greatest challenge that I faced on the job, that is actually a good question. I kind of got to think about that one. So I think the one challenge that comes to my mind from my nursing experience is when I had to share with a family member that their loved one was deceased and they passed away in the hospital. So that was pretty challenging because I had to I had to share, news that I knew would hurt the family member, the news that was uncomfortable to hear. But I'm grateful for that opportunity because I was able to be there for the patient's family members. I was able to allow them to cry on my shoulder. I was able to hold their hand and just let them know that I'm here for them, and I was just grateful that I was able to spend the last few minutes with their loved one, and so that was very special to me. How would you manage a heavy caseload? So the way I would manage a heavy caseload is usually when I start my day, I like to take a look at my patients and look at what their needs are and try to prioritize them. Obviously, we don't live in a perfect world, so things are always changing and shifting. So I just got to learn how to prioritize my patients and make sure that, the patient that is of high priority, I address them first, and then I go down the chain of command, or I go down the priority scale. Also, with a heavy caseload, I will try to use the help of my coworkers if they're available, or I will try to delegate certain tasks. Tell me 3 positive things your coworkers might say about you. So they might say, I have a great sense of humor, I'm respectful, and I'm responsible. How would you deal with an upset physician? So with an upset physician, I would try to listen to the physician and try to hear their side of the story and try to hear why they're frustrated or upset. And I would always just be respectful, and I would not let my tonality change. I will try to stay neutral and just let the physician know that, hey, I know you're upset, but I'm here. I'm trying to do my job, and I would like to work with you. And I want to let you know that this patient needs both of our help. And if we can't communicate properly, then we're compromising the patient's care. So that's what I would tell the doctor and let him know that I'm here to help in whatever way I can, and please use me as a resource. And if I see that, and usually when I say those words or I approach a physician that way, they usually calm down and they're more approachable. But if I feel that the physician is still being upset and angry and not wanting to communicate with me for whatever reason, then and that would lead me to go up the chain of command and try to report it to a supervisor or a director. And then last question for you, Sam, how would you deal with an upset coworker that is difficult to work with? So with an upset coworker that is difficult to work with, I would try to approach them and let them know, hey, this is a problem. This is the problem that I see. Can we work on it? Is there anything that I can do to work on it to make things better, to make our relationship better here at work? And I'm the type of person that does not hold an ego or a grudge, so I'm very easygoing, and I try to work with coworkers that are difficult to work with as much as I can. But if I feel that they're still giving me resistance and it's still becoming an issue and patient care can be potentially compromised, then obviously that would lead me to take it to a supervisor, take the issue to a supervisor or a director, and follow the chain of command after that. But usually my first reaction is to try to work things out with that coworker directly. All right, so guys, that's how I would answer these questions for an interview. Let me know what you guys think. I hope this helps you. For all you nurses that are looking to transition into nursing case management, I hope this video helps you and it suits you guys. Put a comment below and give me your thoughts on this video. Don't forget to subscribe, and if there's any other topics you guys want me to talk about, feel free to comment in the section below. See you guys later.